number one vitamin D danger you must know.
Is there a danger from having too much vitamin D? I'm Dr. Eric Westman, and welcome back to a Dr. Westman Reacts. If you don't have my top 10 tips on how to start keto the right way, look in the description below, please. I was sent a video from Dr. Sten Ekberg, done by him, not from him, and I'm remembering his name because I've heard that he does lots of keto kinds of talks and a very prominent internet influencer, I believe a chiropractor by training. And the videos are very informative, and I've heard through my patients who've come to me that he's been very helpful. I don't know that he's done any basic science and research on his own or has that kind of background, but he certainly is a teacher, as you'll see in this video. For vitamin D, I have to have a confession. I've never prescribed vitamin D. Yeah, let me say that again. I confess that I've never prescribed vitamin D. The reason for that, as you'll see in this video and in other studies that you look around to see, is that there's really very little randomized controlled trial evidence, prospective studies to show benefit from vitamin D supplementation. So it's in an area that really is kind of on thin ice, if you will. Let's get to the video.
Hello, health champions. Today we're going to talk about the number one vitamin D danger you must know. You can make a very strong case for vitamin D being the number one deficiency in the world. And not only that, but it's of critical importance. And we're only just learning just how important it is. In fact, some people have said that it's a biomarker of chronic disease and frailty. In other words, looking at nothing else, like you only get one thing on the blood work, and there's a very strong correlation between your vitamin D status and how well you're doing overall. So we're going to talk about a number of critical steps that we all have to have in place in order for us to utilize vitamin D properly.
So how can I be so brash and say I don't treat and prescribe vitamin D? Well, I prescribe a healthy lifestyle of real foods that supply a lot of nutrition, and if you get the optimal nutrition correctly, do you really need vitamin D supplementation? That's my remaining question that really hasn't been answered. So I prescribe excellent nutrition through dietary means. Do I need to add vitamin D? So if you're not going to change your lifestyle and you have vitamin D levels that are low, should you take vitamin D? Here, Dr. Ekberg is really kind of echoing what so many other people have said, that it's the number one deficiency. It's a biomarker of chronic disease and frailty. So let's step back a moment. Just because you measure a blood level of something and it correlates with an outcome of some sort, that doesn't mean that by supplementing and getting the level to a normal or optimal or whatever different range is going to be helpful. You need to turn that information around into prospective studies. Yes, you actually need to test whether giving vitamin D in a prospective manner optimally in a randomized controlled trial to see if an outcome is improved. Now, classically, vitamin D is known for parathyroid disease. You'll hear it in that context. You'll hear it in terms of bone problems. And if people have severe vitamin D deficiency with a problem of bone loss, then there are studies that say that giving vitamin D will probably help recurrence of bone fractures. But in the context of someone who is otherwise healthy and you just have your vitamin D level checked, there's actually very little data in a prospective manner that says even if you just took that vitamin D supplementation without changing your diet, which if you're a patient of mine, you've already changed your diet, so you're changing the inputs into your system, including the vitamin D that you're getting. So, but even, let's say you're just eating a regular, typical American diet with carbohydrates, there's really no study that's turned that around into, okay, the level is low, let's randomize people, give some people the vitamin, others, and raise the level up and watch and see if the outcomes are reduced. Those studies haven't been done. So we're going to watch a lot of background about what vitamin D does, and in the absence of studies that show that giving the supplementation works, we have to really say we don't know if the supplementation works.
And if you want to follow along and get a copy of these slides, then there's a link down below so that you can get that. Now, when we're talking about what vitamin D does, there is a classic role and a non-classic role. So typically, vitamin D is primarily associated with calcium, phosphorus, and bone, about getting vitamin D gets calcium into the bone so it can harden and make proper bone. And this was found out in 1920 based on something called rickets. If you have a severe deficiency of vitamin D as you're growing up, as your bones are growing and lengthening, you can't make hard bone and you get what's called osteomalacia, soft bones. And they found out that vitamin D was completely responsible for these soft bones. And as soon as they provided some vitamin D, they solved the problem of rickets. But that was only one thing. That was the first thing they found, but it's only one thing of what vitamin D does. So now we have learned more about its non-classic role, and this has to do with immune function, about activating immune cells, regulating immune cells, has to do with apoptosis, the lifespan and the programmed cell death of cells. Vitamin D is critically important to regulate inflammation. So if vitamin D is low, inflammation goes up. It is also involved with neurogenesis. That means building new brain tissue, making new brain cells, new brain connections, as in repairing brain tissue after concussions maybe, but also in terms of learning new things. You have to make new connections, and vitamin D is critical for that.
Well, and so having a list of the things that vitamin D does, it kind of makes you want to take it, doesn't it? It makes me want to, well, therefore I should take it in a pill. Well, let's hold the horses here. And until there is solid research to say that replacing the vitamin D level with some kind of supplementation helps reduce some kind of outcome, again, we're looking at correlations and not showing that even if you might add a treatment, that there may be a problem of giving the treatment. And actually that is the danger of the vitamin D that Dr. Ekberg finally gets to.
But how much vitamin D do you need to take? We've pretty much concluded that most people should supplement, but how much?
Well, and the conclusion of supplementing to most of the doctors today who are checking vitamin D is to get it into a range that most people have. And there are not prospective randomized trials showing that getting that vitamin D level into that range reduces outcomes. So we're in that gray area. But if you're going to take vitamin D, excuse me, and if it's cheap, you don't mind buying it, and you don't get the toxicity, which we'll get to right now, you might want to take it. So let's see what Dr. Ekberg says.
So the basic recommendation is that you should get at least 600 IUs per day, international units. And if you're over the age of 60 or so, you should get 800 IUs. Now, if you're in a different part of the world, sometimes they measure this in micrograms, and then you divide the international units by 40 to come up with the micrograms. And some nutrition labels will have both. The standard guidelines also say that 2,000 IUs is the max that you should ever get. Now, here's the problem, that for a lot of people, that is not going to be enough. That 2,000 IUs might be okay for some people. And it's a lot of genetic factors. It's about sun exposure, etc. But 2,000 IUs is not going to be enough for most people. 5,000 is going to be okay for a lot of people, but we also have a lot of people in the clinic taking 5,000 IUs and they're still deficient on their blood work even after months of taking that. And we test vitamin D on everyone in the clinic. Some people take 10,000 and it is probably too much for most people. So in the clinic, we find that the majority of people probably center in around 5,000 IUs. If they take 10,000, that's, if they're really deficient, we probably put them on 10,000 for a month or two. But in the long run, 10,000 is going to put you over. It's going to put you into vitamin D toxicity, which is also something that you really don't want.
So that was the point of the video through the teaser is what do you want to watch out for? It's vitamin D overload. And I recall in general training that the water-soluble vitamins, you just kind of urinate out and you don't get the toxicities from them. But the fat-soluble vitamins, vitamin D, A, K, and DAKE, are the ones that you can actually get overload if you take too much of these vitamins. I have to say, I don't prescribe vitamins independently. I might ask people to take a multivitamin as they're losing weight or as if they're concerned about not eating enough, which happens when you start eating less and you lose weight on a low-carb, real food-based diet that I teach. But the idea of using an extra vitamin D supplement is novel to me, and even until there's data in the context of people who eat low-carb diets with really great nutritional sources like meat, poultry, fish and shellfish, and eggs. I'm not going to be recommending vitamin D because you have to be a little careful. You don't want to get into this overload, which Dr. Ekberg now talks about.
So here's the thing. Because there's so many variables, so much individual variability and so many factors to weigh in, you really don't know unless you measure. You got to get a blood test and you got to get the levels. So next time you do blood work, you have to either order it or insist that they put it on there. And once you get your results back from the blood levels, what are we talking about? What should a good level be? Well, less than 20 nanograms is, like we said, it's deficient. It is much under. It's in the red zone, basically. And if you're in the US, typically they're going to measure nanograms per deciliter. If you're in other parts of the world, they might measure in nanomoles per liter. And the way to get from one to the other is you multiply the nanograms by 2.5. So I'll give you both units here. Then in the orange zone, meaning you're insufficient, it's still too low, but it's not critical, that's 30 nanograms, which would be 75 nanomole. Now, what most people who are involved with functional medicine, with nutrition, with holistic practices, that people that do a lot of blood work and specialize in that, they will set the lower limit at 50 nanograms.
So, interesting. I've never checked a blood level for vitamin D, and I'm not sure that I should. I was taught once by a teacher that what we measure in the blood is convenient. It's not always important to know. So measuring the blood is convenient. What we really want to know is the function of the human, of the organ or the entire organism. And the reductionistic sort of approach here, where we can actually fine-tune a vitamin and a vitamin level without regard to all the other things that are at play. There's no mention of measuring the inflammation or the other outcomes that vitamin D may or may not play, or vitamin D supplementation may not affect. That just because there's a range in a population of levels to say that we want to get people into that normal or the middle range of a bell-shaped curve doesn't necessarily mean you're going to be doing good. If you are a person who eats a low-carb keto diet, your ketone levels are going to be way outside the range of what we see as normal. I mean, meaning those who eat carbohydrates. It's not normal or typical to see someone with elevated ketone levels who eat carbohydrates. So the lab values you get from the LabCorp or Quest will say that if you have ketones in the blood, it's abnormal. It's outside that range. So here they're doing the same thing with vitamin D, finding a range and saying that everyone should be in this range for some optimization of something or other that really has never been measured in prospective clinical trials. Sorry to say, well, no, I'm not sorry to say that. It's using the background that I have in what's called evidence-based medicine, where you have to turn associations around into prospective clinical trials before you make a conclusion or a practice policy to make a treatment like this. So I'm hearing all this as if it's written in stone and that we know that you're going to be better off. I'm not so sure.
Which would be 125 nanomoles. And the upper end of optimal is probably around 80 nanograms or 200 nanomoles. So that's the range that you're looking for. Optimal is between 50 and 80. And the reason that we want to be in this range, and for a lot of people, you probably want to be toward the higher end of that, is that while some people can probably get by with 30, like we just talked about, there's so much individual variability in terms of absorption, in terms of binding protein transport and vitamin D receptor and your availability of cofactors, that if you have one or more limitations along the way, then you have to compensate by having some more. So if you are hovering around the upper end, you're probably doing well. But we also get people in on the blood work, and now they're over 100. And this is where we want to back off, because there is such a thing as vitamin D toxicity. It can put your blood calciums too high. It can cause all sorts of problems in your body. So you really don't want to go too high either. And that's why it's so important to measure this stuff. So 100 nanograms would be 250 nanomoles. And where it really gets to be a problem is over 150 nanograms or 375 nanomoles. This is vitamin D toxicity. And it's not real easy to get there, but you want to make sure you don't get even close. You probably have to take tens of thousands for quite a long time, but like we said, there's also some variability. And we've had people get to 100 without taking a whole lot. For some people, that could be 2, 3, 4, 5,000, and other people need to take 10,000 and they still don't get there. So,
well, I'm going to kind of close it up there. So the conclusion is that you can have too much vitamin D. So that's the number one danger of taking vitamin D supplementation. And if you don't have your blood levels checked, since I'm not someone who does this on a daily basis, it seems to me that you have to be careful. If you're taking vitamin D supplementation, you'll now need to have your blood levels checked. And the goal is to get you not toxic, but into the range of other people's blood levels of vitamin D. And it's just, this is not really very scientific. This is association and with theory about what vitamin D does, which is, or actually the mechanism of vitamin D does. But that does not mean that if you take people, randomize them to vitamin D or placebo, that they'll have less inflammation, that they'll have less cardiovascular disease. And now I wonder, in the context of a low-carb keto diet, whether this applies at all. You know, so if you don't eat a keto diet, you're not eating great nutrition. This might be the way you want to do things. You know, most doctors don't talk about food. They diagnose you with things and put you on medicines. My approach is to talk a lot about food. In fact, make good food be your medicine, and then you don't have to take all of these other supplements. And so I'm afraid I haven't prescribed vitamin D, don't think I will at this point either, unless someone is super low and has symptoms from it. But even then, I probably would refer to my endocrinology colleagues. That's because I have that luxury inside an academic medical center at Duke. But the other powers that be, I scanned recently the American College of Physicians guidelines, the U.S. Preventive Services Task Force, these are rather conservative, evidence-based medicine organizations. I typically wait until these sorts of guidelines start making changes that are positive, because they scan and look for high level of evidence before they make a recommendation in their guidelines. So I don't really want you to take vitamin D supplementation. I want you to change your lifestyle and diet mainly to become very healthy. A healthy way to do that is the program we teach, which is low carb and keto, and using real food, not fake foods and keto junk foods that are out there now. So I'm not persuaded. I like Dr. Ekberg's style. I know he's taught a lot of my patients who come to me, and I think he's a good source of information, but is now I see as an adopter of a lot of the functional medicine or maybe even chiropractic sort of treatments that really don't have the solid level of evidence that a more, I would say, more traditional internal medicine endocrinology group would adopt. So that's a bit of outside my comfort zone, and I haven't found it necessary to use this in my clinical practice. I hope that's helpful. If you like this, please like, and please subscribe so you don't miss out on further content. If you don't have my top 10 tips on how to start keto the right way, please look in the description below. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.